Good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Heard here in KHP 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on a Wednesday morning version of the show, and good friend of ours, a Pittsburgh boy, born and raised, an ophthalmologist extraordinaire, the most unusual ophthalmologist you've ever met, certainly that I've ever met too, continually comes back and brings us messages on how you can restore vision. Today, an impromptu show because a call from Ed just a week or two ago had his dander all riled up. We're going to find out why because, as it turns out, there's some pretty interesting information. If you have eye diseases, in particular if you have macular degeneration, in particular if you have wet macular degeneration, you're not going to want to miss the show today. Let's bring our good friend Dr. Edward Kondrot to the microphone and say good morning, Ed, and welcome aboard.
Good morning, Dennis, and it's always great to be on your show and share information with the listeners.
Well, you know, this sharing of information on this particular show today, I think, is going to get everybody's dander up. But let's back up. About a week ago, or maybe a little longer, you gave me a call, and your dander was all riled up. And you said, we got to do a show on this one. This is absolutely bugging the heck out of me. Give us a little bit of background on how you got your dander so worked up, Dr. Kondrot.
Well, you know, I've always been concerned regarding injections for wet macular degeneration. The number one reason, it goes against natural laws of healing. Just like you, Dr. Courtney, I like to look at the underlying problem. I like to solve the mystery of why they have leakage and bleeding instead of just giving them this caustic drug, dangerous drug. So I've always been a little concerned, but I was kind of reserved because, you know, folks that are losing their vision, you got to do everything sometimes. Then when an article came out, it stated that 20% of folks that get these injections will develop retinal atrophy. That's when I said, we got to do something. 20%, that's 1 out of 5.
1 out of 5.
Retinal atrophy is death. It's beyond death. You have dysfunctional retinal cells, then you have death, then you have atrophy. So this is serious.
Yeah.
So then, when I started to do some serious research on this, I could not believe it. Misrepresentation of data, payoffs from the drug companies, on and on and on. And so I termed it the Watergate of Eyecare. But I want to just do a disclaimer for people that are listening. You know, wet macular degeneration and degeneration is a serious problem, and I think that everyone needs to be informed of treatment options. And really, don't be bullied into injections. A lot of times eye doctors put fear in you. Unless you have these injections, you'll go blind, etc. My advice is get a second opinion. You know, explore your options. And I hope to share with the listeners what some of those options are. But first, I'd like to talk about, you know, what is the problem with wet macular degeneration. Do you want me to talk about...
Set the stage for this discussion before we get into this conspiratorial, and boy, it is really a conspiracy. Just give our listeners a bit of an overview on this thing called macular degeneration, the fact that there are a couple of types, and then if you have this one particular type, you are very vulnerable to having things done to you under the guise that it's to your benefit, when in fact it could really be to your detriment. Ed, with that stage being set, why don't you take it for a minute and educate our listeners on MACD?
Well, there are two types of macular degeneration, dry and wet. Dry is the more common version, and often the dry will lead to wet. Dry is just like the word describes. It's dry, atrophy, death of the retinal cells. The wet macular degeneration is when you have leakage into the retina, into the vitreous, which causes a loss of vision. So initially, it was felt that if we could give a substance which prevents these little blood vessels growing into the eye, and it was measured, there's something called vascular endothelial growth factor. Whenever there's decreased oxygen in the eye and the retina, little tiny blood vessels grow. So they thought, why not give an anti-VEGF, vascular endothelial growth factor, to prevent these little blood vessels into the eye? And so there was a product available. It was called Avastin, and it was approved by the FDA for the treatment of colon cancer. So eye doctors began experimenting with this drug, and lo and behold, it did reduce some of the swelling, and short term, it did have an improvement of vision. So there was a study done. It's called the CATT study, C-A-T-T, Clinical Assessment Trial for Macular Treatments, CATT. And what they did is they looked at patients over 2 years, looking at Avastin and another drug called Lucentis. And they wanted to find out what happened over 2 years. So it was a very good study, long-term effects. Now, the conclusion with this study was that if you have the injections, 95% of patients will have vision stability. If you don't have the injections and you get a placebo, 62% will have vision stability. So when you first look at that data, you think, oh, that's pretty impressive.
Yeah.
I'd like to have a treatment where there's a 95% chance of vision stability. But they define vision stability or vision maintenance as plus or minus 15 letters on the eye chart. So you could lose 15 letters, which is 3 lines on the eye chart.
3 lines.
And be defined as a success.
Only in American medicine, Ed. Only in American medicine. But what a double-handed, no-good, dirty, rotten, low-down scheme to play on the public, to publish it that way, to say that 95% of you will have your vision stabilized when, in fact, you could lose 3 lines on an eye chart and still qualify for that. That is not playing kosher.
Now, also, let's look at the analysis of the study. And this was published in major ophthalmology journals. And I'm quoting from the CATT study. 1 or more serious systemic adverse events occurred in 255 patients, 21.5%.
21%. What were they at? Systemic side effects?
Systemic side effects. You want to hear what those effects are?
Yeah, what are they?
Thromboembolic events such as stroke, myocardial infarction, gastrointestinal perforation, hypertensive crisis, congestive heart failure, or neutropenic sepsis. That means loss of white blood cells with a serious infection.
Can't fight infection. This happens 20% of the time?
21.5% of this study group that had the injections over 2 years.
Wow.
Now, that doesn't even look at ocular side effects. Endophthalmitis, that's a severe infection which usually can lead to blindness. Retinal detachment, glaucoma. In fact, right now in my office, I'm treating a gentleman who had 20-some injections, and he has uncontrolled glaucoma in the eye they've been injecting. Also, cataract. And the icing on the cake, which really angered me, is 20% of patients. Well, I'm exaggerating, Dennis. It's actually 18.3% of patients developed retinal atrophy. And this was led by a team of researchers out of the University of Pennsylvania, by Dr. Grunwald, who's an ophthalmologist at the University of Pennsylvania. And he stated after 2 years, they found that geographic atrophy had developed in 187 patients out of this group, or 18.3%. So my question is, why would you want a procedure that has a 21% rate of serious systemic side effects, that has all of these ocular side effects, include 20%? You know, Dennis, you and I went to medical school, and we took the Hippocratic Oath. And what is the first part of the Hippocratic Oath?
Do no harm. Do no harm.
Now, it gets even more interesting, and this is where the Watergate aspect comes in. The New York Times Magazine revealed a secret rebate program in which the Lucentis manufacturer Roche started offering physicians financial inducements, $60 per dose for prescribing large quantities of this drug. And many retinal specialists perform over 1,000 injections per year, and some perform far more. So there's a substantial side income for recommending. So the question is, are they doing what's best for you, or are they doing something based on manipulation of study data and based on financial incentives?
Very legitimate question. This thing about the payoff that the drug company will give the doctor for using their drug is nominal, but over the course of a year, if you say you do 1,000 injections, that's substantial unto itself. But as an eye doctor, Ed, could you maybe inform our listeners how lucrative is the fact that ophthalmologists can do these injections and be paid through insurances or out of pocket? How's that usually handled? And how much money are we talking about here? Because I think once the listener sees that level of money, then they really begin to make sense of all that we're saying about the conspiracy. What is it?
Well, the injections, doctors are charging anywhere from $1,000 to $3,000 an injection. It's essentially a 10-second procedure that's done in the office.
10 seconds.
Now, I know patients will say, well, I don't have to pay. It comes from my insurance. My insurance pays. But somebody has to pay for that. So, now, I want to make something clear, that I'm not totally against injections. Because, as many of your listeners know, I wear two hats. I'm a board-certified ophthalmologist. I know the surgical side, but I also know the alternative side. I would much rather start with treatment that has no systemic side effects, no ocular side effects, no kickbacks from Big Pharma, and no study data manipulation. Alternative treatments which essentially strengthen the body and treat the underlying cause. Why not start with those? Now, the question is, well, do these alternative treatments work? Why haven't there been any good studies? Well, there are studies. In fact, I had an article that was accepted for publication in Alternative Therapies in Health and Disease, which showed a significant improvement in vision parameters in this group of patients that have wet macular degeneration. So this is going to be published. And I think many of the listeners know that they can get these treatments done in Pittsburgh. Dr. Courtney, you're one of the few doctors who have gone through a very intensive training to do these alternative treatments that can be very successful. But I just wanted to say that if I have a patient who's receiving these alternative treatments, like microcurrent, I hope we can talk a little bit more about that, these treatments, and if they're still losing vision, then I would recommend, hey, you got to get these injections. But to do the injections as a first-line treatment, I think that's a big mistake, especially when you look at, my goodness, you look at the side effects, the systemic and ocular side effects, and the manipulation of data and the payoffs.
Yeah, certainly this kind of an explanation isn't coming from the doctor who's recommending this. I had a patient just the other day. She already had 4 injections. She is been told by her doctor she needs the 5th one. And I said, just hold that thought right now. Just hold up. You got to hear the show today. To be able to make a decision like that, you have to get all sides. And unfortunately, Ed, I don't believe they're getting any of this side of the discussion presented to them by their doctor. I think it would be it's just inconceivable for me to think that he's going to mention that there's systemic diseases and ocular, and there's we manipulated the data as well as I get paid off. Nope, not going to come from.
Well, I'm hoping, Dennis, that this is going to open up the eyes to a lot of retinal doctors, that they're going to begin to look at other modalities, other treatments. And I'm not saying that all retinal doctors are unscrupulous, but if the patient, the consumer, really understands the risk that's involved, I think they're going to really look for alternative treatments first.
So the take-home message really is, Ed, with all that you've revealed today, and I think you've appropriately dubbed this the Watergate of Eyecare, with all that conspiratorial stuff going on, I don't see how you could avoid not coming to that conclusion. You're saying, look, you should absolutely be doing a much more conservative and holistic approach first, and if no one can get the response from that, then it's almost justifiable to run the risk of all those other things, because if this hasn't benefited you, I'm talking about the conservative approaches, then you do have to save vision in the best way you can if that's your last option, but it should be your last option and not your first. Isn't that what you're saying, Ed?
I really believe that. Now, a lot of retinal doctors will bully the patients. They'll say,
they
you
will.
have hemorrhage. Unless we do an injection immediately, you're going to develop scarring of the retina, which is true. You know, the injections may reduce the incidence of scarring, but 20% of patients who get these injections will have retinal atrophy in the end. So maybe short-term, it may help reduce the problem, but long-term, you are looking at a devastating complication, retinal atrophy, which is beyond death of the retinal cells. It's, you know, you have death of tissue, then you have atrophy, which nothing is there.
It just shrivels up.
It shrivels up.
Yeah, the area shrivels up. So an Ed Kondrot program can't even rescue that area, I think I should emphasize. Once you get retinal atrophy, it's like that zone doesn't exist anymore. And if that's large enough, your vision loss as a result of it, I'm going to imagine, could be substantial. Couldn't it, Ed?
Well, it varies from case to case. But, I mean, you've been doing my program and you've been treating patients using these alternative therapies, and your results are quite remarkable. And certainly, I think if you look at your results compared to the CAT study, you're probably... How many patients, Dennis, have lost 15 letters?
Oh, yeah, that thing about the 15 letters. You and I would both consider what we do, and, of course, being trained by you, I became very accustomed to seeing people gain. I'm going to underline the word gain, considerable number of letters on occasion, but gaining letters, not losing any letters. To think that the definition for stability, 95% stability, is you could lose up to 3 lines, that's 15 letters, 5 a line, and still be considered to be stable. You and I consider that an abject failure. You and I wouldn't be able to face a patient if they had to lose that amount of vision. That just irritates me, and I know it got your dander up, which is one of the reasons why we said we have to do this show today.
Yeah, so I think the take-home message, which is really important, is that, if you're listening out there and you have wet macular degeneration, do your research, talk to your retinal doctor. These statistics are well published. They're real numbers based on a 2-year government study. They exist out there. And I really think you need to explore alternative treatments. And it just makes so much more sense, because anytime you have a health issue, it makes sense to look for the underlying problem. Why are you developing the wet macular degeneration? And often it's because of heavy metals, decreased oxygenation, decreased circulation, cardiovascular problems. And if you correct these underlying causes, many times that alone will improve your condition. So don't look for a short-term Band-Aid, which has a high rate of complications and side effects. I think that I'm kind of, I'm angry, Dennis, and at the same time I'm excited, because this is going to be opening up more opportunity for us that are doing integrative and alternative treatments to help these people, to truly help them,
Well, I just wanted to make a little final point of emphasis, and then I want you to really talk about the positive side of your program and how it is that we can accomplish what we set out to accomplish in a way of getting eye improvements. But this study is not an obscure study. It involved, like you said, 1,024 patients, followed them over 2 years. It was done at the University of Pennsylvania. This is no obscure institution. This is a major medical institution and a major study. Do you think it's even possible that if you're a retinal specialist, you haven't heard of this study? Is that possible?
Oh, no. Every retinal doctor knows of this study. But, look what happened with the announcement of the chelation study, the TAC trial. A 39% reduction in major cardiac events, people that have chelation. Did the American Academy of Cardiology embrace this study? No, they found fault with it. They said the data was poorly collected. And I think ophthalmologists are being blinded by this study. They say, yes, there's complications, but there's nothing else we can do. We have to do something. And, of course, there's a financial incentive. I would like to make $3,000 every 10 seconds by giving an injection, and to boot, get some money on the side from the pharmaceutical company.
$60 sweetener. Oh, goodness gracious. All right, I think that you had a real justification for getting your dander up. You got my dander up after reviewing how it was. You got your dander up, and I'm going to guess that if you're out there listening to us right now, you're just shaking your head, and it all, unfortunately, makes too much sense. I think that's why you end up shaking your head if you're a patient listening to us today, going, you know what, why not? Yeah, I understand it. I don't even question the fact that this sinister activity could be going on.
Now, I did give a webinar on this subject, and I think you have a copy of all my slides of the webinar, so the listeners can call up your office. You can send them a link so they can listen to my comprehensive webinar on this subject, reviewing the data, giving all the statistics, citation of journal articles if they're interested in this. And you know what they can do? They can copy it, take it to their retinal doctor, and show it to them.
You don't mind your work being shown to your retinal doctor? This is this is getting even all the better yet. All right, here's what I want you to do, Ed. We're going to switch a gear. We've come in with the bad news and the unsettling news, but let's talk about your program because you put something together. You've now published it. Your statistics are now going to be available for all to see and read, whereas before it might have been difficult to find unless you went to your website or mine. But let's talk about what your program consists of that allows you to gain vision, not lose it, not 15 letters of loss, but many letters of gain, sometimes lines of gain. What gets done in the Ed Kondrot program that allows that good stuff to happen?
Well, most of this material is outlined in my book called The 10 Essentials to Save Your Sight, and I know you have copies of the book in your office, and when you and I give a seminar, we gladly give this book away to patients to educate them. But basically, the approach starts out with the basics. I think you really need to look at your diet. We're poisoning ourselves with genetically modified food, with food that's been preserved, that has pesticides and preservatives. Well, we have to look at our diet. And if you don't have those essential building blocks in your body, you don't have the nutrients, then there's no hope for your body to repair itself. So nutrition is essential. And you'll agree with me, we find so many people that are nutritionally deficient that we have to give them intravenous vitamins.
Sure.
To get their selenium and zinc levels up. To me, that's the first step. Then we have to work on balancing the autonomic nervous system, reducing stress. Those of us that are in alternative medicine know that if you're in a stress state, you need to relax the body. The body will not heal unless it's in a relaxed state. And unfortunately, a lot of eye doctors bully patients into injections. If you don't get these injections, you're going to go blind. And if you do get them, there's a chance you can go blind. I mean, what a greater stress state you could have. So then we have wonderful therapies, and these therapies are not new. Microcurrent has been done since the 1960s, and this is a method of using a very low current, which stimulates cellular activity, improves circulation. Published studies show that low levels of microcurrent can improve cellular activity by up to 500%. So we're taking these dysfunctional cells that are dying. We're taking the hypoxic retina, a retina that has low oxygen. We're putting more oxygen in. We're stimulating the cells. And this kind of, in a way, acts as an anti-VEGF factor. Much like the Avastin that's being injected into the eye, these alternative therapies act as a safe therapeutic mode. I mean, I've been doing microcurrent now for 15 years, and really there are no complications if you do it right. There are no complications. It's much like saying exercise. Exercise is dangerous. Well, yeah, if you're out of shape and you exercise too vigorously, you may have some problems, but exercise is good for your body, and microcurrent, in a way, is kind of like exercise for your eye. Mm-hmm. Then, one of, I know your favorite treatments is ozone therapy, and you're involved with an IRB in a special study looking at ozone. And maybe you want to talk about your experience with ozone, which is a big part of the program.
Yeah, because, you brought to the attention of all of us that were trained that oxidative therapies of some type really do need to be part of these 3-day treatment programs that you put together. And then not even just during the 3 days, after the program's over. And I've just found, and I think you will mirror the same findings, that probably the granddaddy, the best of all the oxidative therapies, is ozone therapy. And I know you use ozone down in your practice in Florida, and we're using it here as our premier go-to way of providing oxidative therapies that will engender a nurturing back to health of these retinal diseased cells and allow for a greater improvement over the 3 days. So, yes, I am a big fan of ozone, and I know you are too.
And then, people will ask, well, what evidence is there that ozone can help my eye problem? Well, I published some data which indicates that it helps. In addition, the European studies, there are many European studies. There's a Cuban study, Dr. Silvia Mendez, who's treated thousands of patients with macular degeneration and glaucoma and has shown conclusively that these therapies can reverse. We're just not talking about stopping the progression. She has showed that these therapies can reverse macular degeneration. We have alternative doctors, leading alternative doctors like Dr. Frank Schallenberger and Dr. Robert Rowan, who have presented data showing that ozone therapies can help. How do they help? Well, very simply, they improve the oxygen uptake of these retinal cells. They help to stimulate regeneration. They have a lot of immunological responses. They take care of any infectious organisms in the body, so it has a multi-purpose treatment that can really make the difference. But these therapies have to be done over a long period of time. You're just not going to get 1 or 2 ozone treatments. But it's something that we can offer patients, that these therapies will not only improve their ocular health, but they'll improve their general health.
Yeah, that's for sure. And the one level that I think ozone is far superior than any other therapies that I know of is in this mitochondrial rescue, that really, if you can optimize the mitochondrial function of a cell, it will allow that cell to function optimally. And that's what we're doing, rescuing weakened cells, diseased cells in the back of the eye, and we're bringing them up to their optimal level of functioning. And in so doing, the vision improves, and we can detect it by the way we examine patients and determine at the beginning of day one where they are, and then 3 days later where they've come in just 3 days. It's amazing to see that turnaround, Ed, and I know that the article that you finally got accepted and is it published yet? And it does give all the statistics of your successes over a 2 or 3 year time period, and I believe it's going to be a premier article.
Yeah, I hope that it stimulates the interest of a lot of other eye doctors and integrative doctors to really look at these therapies. But one comment I want to make, and I was just thinking, there's probably a lot of individuals out there who are receiving injections and maybe who are not doing well, and they're probably questioning, what should I do? Should I continue these injections? Should I stop them? And that's a tough decision to make, very tough. And I think you have two options. You can continue your series of injections every month for 2 years, and then the eye doctor will tell you, nothing else can be done, I'm sorry, they're not working anymore. Or you can stop the injections, begin alternative therapies, and carefully monitor your vision. If you begin alternative therapies and you're noticing your vision better and your health is improving, why go back to the injections? But if you're faithfully doing these alternative treatments and your vision is getting worse, then I recommend to patients that maybe you need both. You need the injections and the alternative therapies. But fortunately, those people are in a very small percentage. I would say that they're probably less than 5% of the patients that I see. And, of course, a lot depends on how aggressive you are in embracing these alternative therapies. And we should probably talk about a really big culprit is heavy metal poisoning.
Oh, I know you feel very strongly about it. Why don't you mention heavy metal toxicity?
Well, there's no question that elevated lead, mercury, cadmium, all these products contribute to eye disease, macular degeneration, and glaucoma. You need to be tested. And most people that I see will have elevated lead and mercury, and you have to be treated. You need to undergo some type of treatment to remove these heavy metals, and the gold standard is chelation. And certainly all integrative doctors are now much more aggressive with chelation because of the national study that came up, the TAC trial, the trial to assess chelation therapy. It was unbelievable, the positive results. Of course, they did not look at eye disease. They mainly looked at cardiovascular disease. But the improvement and the decrease in major cardiac events in the group that received chelation was phenomenal. And I do think we see a correlation between cardiovascular disease and macular degeneration. It's part of the body's aging process. So if you have dry or wet macular degeneration, there's a good chance you have early cardiovascular disease. I think the two go hand in hand. So chelation has a two-pronged attack on this problem. Number one, it's improving the vascular circulation. And we know that the decrease in vascular circulation is a trigger to these new blood vessels growing in the eye. Second, chelation removes the heavy metals. There's no question that the heavy metals are a contributing factor not only to eye disease, but to cardiovascular disease and neurological problems such as Alzheimer's and Parkinson's. So I think there's many things that we can do. And by embracing these alternative treatments, not only are you going to improve your health, but you're also going to see a dramatic improvement of your vision. And, I mean, you've been doing the program now for a couple of years, and it's dramatic. In 3 days, the majority of patients will have a significant improvement of vision because we're doing these things that are naturally helping the body to heal.
Yeah, we brought that message over and over again. Significant improvement, I mean substantial improvement, and this issue of losing vision up to 15 letters, I just can't get over that. That's what the conventional medical community has to do to allow them to stay in the ball game and try to make a case for why they should be recommending what they're recommending, when in fact we look at that and we would be embarrassed. Well, we wouldn't be a part of something like that.
Well, it's much like the statin studies. There's something called a relative change and an absolute change. And when they talk about statins reduce the incidence of heart attacks by 50%, the way they manipulate the data is appalling. So if you take 1,000 patients, and maybe 4 will have a major heart attack, okay, without statins. Then you put all those 1,000 patients on statin, and then 2 will have a heart attack. So they say, well, we went from 4 to 2, so that's a 50% reduction.
I hear you. I know what they're doing. I know the games they're playing. Look, I want to, with about 10 minutes to go, I know you wouldn't mind taking it. People out there may want to weigh in. I know there's someone earlier called. Will you mind taking any questions from our listeners?
Oh, not at all. It would be my pleasure.
Come on, you're with Dr. Ed Kondrot. He is the ophthalmologist extraordinaire. He put the famous 3-day Kondrot eye program together, and he's madder than hell and not taking it anymore, and he has bounced back and given you information today you have not been able to get any other place. So give us a call, 412-825-6262, if you have a question. I think we may have a caller out there right now. Come on aboard. You're with Dr. Kondrot. Go right ahead.
Hi, Dr. Courtney.
Hi.
Just had a question. I know he really recommends the microcurrent, but what can a person with the beginnings of glaucoma do as far as supplements or homeopathic? If there's anything homeopathic that can stop the progression of glaucoma?
I know Dr. Kondrot is the world's only homeopathic ophthalmologist. How do you feel about homeopathy, doctor, and what should she do for glaucoma?
Well, the number one thing is that we tend to treat all eye diseases in the same manner. So I know we've been talking about macular degeneration, but it's the same approach with glaucoma. We want to evaluate you for heavy metals. There's no questions that these heavy metals are toxic to the optic nerve and can cause a progression of the glaucoma. Also, diet is very important. Some people think that there are allergies, maybe gluten sensitivity, toxins in the food that are contributing. Remember, glaucoma is more than just pressure in your eye. It's damage and degeneration of your optic nerve. Chelation is a wonderful therapy. Chelation can help improve the circulation to the optic nerve. Microcurrent, same thing. And I know Dr. Courtney does all these things in his 3-day program, which I would highly recommend that you consider. Now, in terms of homeopathy is a little bit more difficult because there just isn't one homeopathic remedy for glaucoma. We treat the person in homeopathy. And by that, I mean we look at your entire life, stresses, other diseases that you might have. We treat you. And sometimes homeopathy can be very, very dramatic in terms of, reversing the glaucoma. So typically my approach is to not only do homeopathy, but to do these other things. I think it's critical that you be evaluated for heavy metals. That would be the first thing that I would recommend. And then look at these different therapies, see what can be done to lower your intraocular pressure, improve the health of your optic nerve.
Okay.
Very good. Thank you very much.
No sort of supplement either, just that would help with that?
Any supplement? Well, I know you have very strong feelings about deficiencies that you find happening in more and most of your eye patients. What are the most common deficiencies you find, Ed?
Well, in glaucoma, one of the most common deficiencies is chromium. So you need the B-complex vitamins. We do have a glaucoma formula that I'm looking at that I put together. But I really believe in individualization. What is one person's medicine may be another person's poison. And that may be a subject of another show, Dr. Courtney. There have been some studies out that there's a subset of patients that actually do worse on certain vitamins in terms of eye disease. And that was also revealed by the ARID study, a national study that was done. So a lot of times you need to be evaluated. We need to treat you. I mean, I do have a generic glaucoma formula that I think is very effective. But vitamin supplementation is not the answer in treating glaucoma. We have to treat you. You have to be evaluated. Do you have a thyroid problem? Do you have any hormonal deficiencies? You need to be tested, and we need to individualize the treatment for you.
Okay.
All right. Thank you very much for your questions. Very good, Ed. We got another caller out there. They're waiting to get at you, Ed. Come on in the store. Welcome aboard. You're with Dr. Ed Kondrot. Go right ahead.
Good morning. Thank you for taking my phone call this morning.
Sure.
I have a rather obscure, I consider obscure because I never heard of it before. I went to I was having a lot of dizziness earlier this year, and I went to see a dizziness specialist at UPMC, and they found that my eyes have taken over for my balance system instead of my inner ear. Have you ever heard of this condition before, and what can be done for it?
Well, there are different eye conditions which can cause dizziness. The most common one is called nystagmus, where the eyes start to jiggle and move, and that can cause dizziness. But you would really need to be evaluated, and, you know, no matter what your problem is, the integrative and alternative approach isn't complex. You know, many of the same causative factors exist for all diseases. Decreased oxygenation, poor nutrition, heavy metal poisoning, and sometimes the most complex disease can be very easily treated by changing your diet, improving oxygenation like ozone, removing the heavy metals.
So does the microcurrent do anything to fix that?
Well, microcurrent improves circulation and also reduces inflammation and can help remove toxins. But, you know, there isn't like one shortcut. It's not like, oh, you start microcurrent, everything's going to be better. You really need to be evaluated by someone like Dr. Courtney. And you have to find out what is going on with your health. But I would probably start. Anytime I hear of a neurological problem, I always think, we've got to test you for heavy metals. We've got to get rid of those heavy metals. Because if you don't do that, you could be chasing this problem, going from one specialist to another, and just simple chelation, removal of heavy metals will take care of the issue. Or maybe even changing your diet. You may have a food allergy, gluten sensitivity. It could be something very simple.
I'll tell you what, it's a great question, and I'm just going to guess that with that diagnosis by the neurological community at UPMC, was there any specific treatment that has been recommended for you? Because I'm going to guess there wasn't.
Well, he mentioned two things. One was a vestibular physical therapy, and the second was clonazepam, which was supposed to take care of the dizziness, but of course I didn't want to take any prescription drugs, so I have not started that at all. I have done the physical therapy, the vestibular physical therapy, but I didn't want to take the drugs.
I agree with you on the drugs. Come on in and let us evaluate you. As Dr. Kondrot mentions, his programs work in so many of these problematic disorders that you have a potential, so great benefit far and above what the conventional community can offer you. Hope to see you soon.
Great. Thank you. Have a great day.
There you go. Well, coming up on the gong, Ed, I want to ask two questions because they've been asked before. I promised I would ask them when I brought you on the show. One of my callers in the past couple of weeks had mentioned they've heard about vitamin injections given into the eye. Are you familiar with any such thing?
Well, I have been considering doing ozone injections in the eye for wet macular degeneration. I am not familiar with the vitamin injections.
All right. That answers that part. And someone else mentioned, no, it was the same person, that there is something called a telescopic implant. I'm not familiar with it. Any implant, any device implanted in the eye, such type?
Oh, yeah, that's been researched and fine-tuned for many, many years. In fact, when I was a surgeon in Pennsylvania, they were working on this telescope, this intraocular telescope, to help people with low vision. Certainly, that would be the last resort. I really feel that there are ways that we can improve your vision with these alternative treatments, no matter how bad your eyesight is. And sometimes people with the poorest vision get the best response, and I'm sure you've seen that.
Oh, goodness gracious.
So I would, this individual needs to first begin some of these alternative treatments to see if they help, but any surgical intervention should be the last choice because it is surgery, and you have all the associated risks with any surgical procedure.
Well, Ed, that's certainly good advice. I want to thank you for coming aboard today, Ed. I hope you got it off your chest, because it was a lot of pressure was building up there.
A lot better. But anybody who calls, I'd be happy. In fact, I've transcribed my webinars in written format. So if somebody wants a written copy, the slide, just you can contact Nicole at the office, and she can forward it to you, or I'll forward you the written report right now.
Thank you very much for that written report. We're going to be having an eye seminar coming up on January 5th. These new slides will be presented, and I know we're working right now with Dr. Kondrot to bring him personally up to Pittsburgh to address you all in the very earliest months of 2015, and I'm sure you'll want to see Ed personally when he comes to town.
Dr. Courtney, I'm going to request we have some security guards at this seminar when I come.
Yeah, you're messing with the big boys now, Ed. Thank you, Ed, for your contribution today. I look forward to talking to you very soon. Ladies and gentlemen, you be with us on Friday for our show then. Until then, this is Dr. Dennis Courtney with Dr. Edward Kondrot saying so long for AM Impact on Your Health.
AM Impact on Your Health is sponsored by Dennis J. Courtney, MD, Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, MD.